Hi all, I am Dr. Pradesh. Today we will discuss about stroke. So we will see what all are the types of stroke, what all are the acute treatment options available, how we will continue the treatment of long-term treatment of acute stroke. We will see one by one. Treatment of the stroke is divided by the type of the stroke the patient having. So there are mainly two types of stroke. One is IC bleed, that is a blood vessel inside the brain will be ruptured and blood will be flowing out into the brain parenchyma. We have very limited treatment options available for these conditions, like we may reduce the pressure inside the brain, we can do life-saving surgery for reducing the brain pressure inside the brain, and also control of the blood pressure, and we can help the patient to tide over the critical situations, and also lifelong long-term physiotherapy for the patient. Main treatment options are available for the second type of stroke, that is ischemic stroke, in which there will be a block in the blood vessels carrying blood to the brain parenchyma, and that part of the brain parenchyma will be damaged. Now we will see what all are the emergency treatment options available for a person with acute stroke. So first and foremost thing is to identify the symptoms of acute stroke and seek treatment immediately. So symptoms of sudden onset can be due to acute stroke, like some sudden onset of balance problem, difficulty with vision, facial weakness, upper limb or lower limb weakness, or sudden onset of speech problem. This can be due to acute stroke. So whenever one person develops such symptoms, he has to seek treatment from a center with facilities for imaging and neurology treatment, acute stroke units available, etc. Now we will see, once we identify the stroke symptoms and reaches the hospital in time, what all are the treatment options available. The first and foremost thing is intravascular thrombolysis, that will dissolve the clot formed inside the blood vessels by giving a intravascular injection. So in that way, the clot will be lysed and it will re-establish the blood circulation to the brain, and that will prevent the damage happening to the brain. So this can be taken up to 4.5 hours from the onset of symptoms. Next is about mechanical thrombectomy. That is, if the clot is formed in a bigger blood vessel, that means if the bigger blood vessels are blocked, that injection may not dissolve the clot completely or may not lyse at all. In that case, we will introduce one catheter and will remove the clot mechanically. That is known as mechanical thrombectomy. In same way, that will re-establish the circulation and prevent the damage happening to the brain. So in this part, I mainly want to convey the importance of time, because we can give that injection only till 4.5 hours from the onset, and mechanical thrombectomy usually that done till 24 hours from the onset of symptoms only. Next is about how we will continue treatment after that acute treatment for stroke. That means uh, even after taking that injection or doing thrombectomy, some weakness are still persisting. How we will manage, or due to various reasons we were not able to get that acute treatment, that uh, thrombolysis or thrombectomy, we were not able to get it. So how we will continue the treatment for stroke? So first and foremost thing I have to say is, even though it is not as effective as thrombolysis or thrombectomy, patient may improve with continuing care and physiotherapy. There will be progress in symptoms. Regarding long-term treatment of stroke, different doubts patient may ask, like whether it will improve and how much it will improve, when it will improve, like that, and how they have to treat the comorbidities like diabetes, hypertension. We may take one by one and see. when we discuss about the long-term treatment of stroke, the main thing is about tablets given for preventing further stroke. Usually we give antiplatelets group of drugs like ecosprin, aspirin or clopidogrel, etc. So we may have to continue that treatment, or very often we may have to take it lifelong. So that tablet is not for any progression of that stroke, but it is mainly to prevent further stroke. So if there is any drug default, there may be chance of another stroke. So when a person develops stroke and if he is gradually improving, and if he default the drug and if he develops further stroke, that may impair the further progression of the situation. So very rarely for some surgical procedures or tooth extraction, we may have to hold the tablets temporarily, and if so, that has to be done under strict supervision of a doctor and has to be restarted immediately. Patients taking such drugs should avoid trauma, injuries, etc. Because once the patient, since the patient is taking such drugs, there may be chance of prolonged bleeding from the injury sites. So next thing is about using anticoagulants. So certain group of patients may require more potent drugs known as anticoagulant drugs compared to usual patients who takes antiplatelets for prevention of further stroke. So for example, if may say uh, patients with a problem with heartbeats, like conditions like atrial fibrillation leading on to stroke, problem with heart pumping like heart dysfunctions, or valvular heart disease leading on to stroke, or genetic conditions leading on to hypercoagulable state. These patients may require more potent drugs like anticoagulants. Like for example, if may say drugs like warfarin, acetylene, apixaban, rivaroxaban, etc. Patients taking drugs like warfarin or acetylene require strict follow-up and monitoring by a doctor, because they may require titration of the drug dosage according to the blood level. For example, if we may say if it get more thinned out, there is more chance for hemorrhages or bleeding manifestations in the body, and if it is inadequately thinned, there is more chance for recurrent stroke. Usually we do adjustments in the dosage according to a parameter known as PTINR. So we have to check that according to the doctor's advice and have to adjust the dosage. And also we may have to adjust our diet according if the patient is on warfarin or acetylene. For example, if we may say we may have to avoid green leafy vegetables or green leaves. So we may approach a dietitian and get it written down which all diet can be taken, which has to be avoided. And like we have already discussed, patients who may require some surgical procedures or tooth extraction, they may have to stop the drugs and restart according to a strict supervision by a doctor. Next, we will talk about stroke rehabilitation. So, we have seen that even after getting treatment for acute stroke, some disabilities may remain. So, how we will make progress in these symptoms, disabilities? So, rehabilitation is a solution for this problem. So, that we have told you that whatever damage happened to brain, that may remain. Unlike many other body parts, the brain has got no regenerative capacity. So whatever damage there, it will be remain there for ever. So, but there will be enough of normal brain left. That normal brain can take over the function of the damaged brain through a property known as neuronal plasticity. This rehabilitation rehabilitation helps the patient, helps the normal brain to take over the function of the damaged brain. So that has got many components like physiotherapy, occupational therapy. If the patient has got swallowing problem or speech problem, we can do speech and swallowing therapy. Depending upon the severity of the problem, if there is minor dysfunction only, we can do it our home. If there is severe problem, we may get admitted in some rehabilitation center and do detailed rehabilitation services. One more doubt that stroke patient used to express um, is about regarding the management of comorbid illnesses like management of diabetes, hypertension, or cholesterol dyslipidemia. So we may see it one by one. First is about management of diabetes. So for diabetes, we have to follow the advised medications. We have to adjust our diet. We have to avoid extra sugar in diet. We have to avoid high calorie foods items. And for adjusting medication, we may approach a physician, and we may do some simple exercises like walking uh, 1 or 2 times a day. And for even after doing all these steps, if blood sugar remains high, we may have to add insulin into our medications. So basically, in a patient with a stroke and diabetes, what parameter we follow is a parameter known as HbA1c, which will indicate the status of our diabetes, our blood sugar level for the last 3 months. So for a patient with diabetes and stroke, it is recommended that this HbA1c should be less than 7. Next is about control of blood pressure. So in a patient with a stroke, it is recommended that the blood pressure should be less than 130/90. So we have to follow the prescribed medications strictly. Different drugs are used for controlling blood pressure. For example, AC inhibitors, ARB, diuretic. So that mainly depends upon our comorbid illnesses, our age, so many factors, and it will be decided by the physician. So other steps that also we can do, like some simple exercises, avoiding extra salt in diet. These all may help to control the blood pressure. Next is about controlling the cholesterol levels. So it is mainly decided by the level of LDL cholesterol. Within the cholesterol, we have many components. So we will mainly monitor this LDL cholesterol level. So it is recommended that for a patient with stroke with no other major diseases, the LDL cholesterol should be less than 100. But if the patient has some other illnesses also, like some heart attack he had, or some vascular diseases, it should be less than 70. So what we will do it, we will start the medicines and we will recheck it by 1 month. And if it has reached the recommended level, we will repeat the checking every 3 months and will ensure that it is in the recommended level only. Otherwise, we may adjust the medication. So we can seek a help of a local physician for adjusting these medications. Next is about obesity. Obesity is considered as a risk factor for recurrent stroke. So we have to adjust our diet and do exercises and reduce our body weight. And usually we monitor a parameter known as body mass index, BMI. We monitor the parameter and adjust our exercise and diet. One more doubt patients used to express is about diet, what they can have, what they have to avoid in diet. So we have seen that patient with comorbid illnesses, stroke, and with comorbid illnesses, diabetes and hypertension, they may be following the corresponding dietary patterns. For example, if you may say patient with the diabetes, we will advise them to avoid extra sugar in diet. Patient with hypertension, we will advise avoid extra salt in diet. So other than that, patients taking anticoagulant group of drugs like warfarin, acetone, they have to avoid green leaves and green leafy vegetables. So, but patients taking ordinary drugs like ecosprin, aspirin, clopidogrel, they need not avoid these green leafy vegetables. So, apart from this, one more pattern of diet which is found to be useful in stroke patients is a diet known as Mediterranean diet. So, if we say some details, we have to add more plant-based foods like vegetables, fruits into diet, and we have to avoid the content of meat. We have to decrease the content of meat in diet, but we may add more fish into our diet. and we have to avoid bakery items, and we have to use the cooking medium like olive oil and peanut based oil for cooking. More details are available in internet, you can see, and or we may approach a dietitian to prepare a diet based on Mediterranean diet. Next is a few points about exercises for stroke patients. So engaging in regular exercises will avoid chance for recurrent stroke. So it is recommended that if you are doing moderate kind of exercises, we have to do it for 10 minutes at least for 4 times in a week. But if you are doing vigorous kind of exercise, we have to do it for 20 minutes, that at least twice in a week. Those who are not recovered fully from disabilities have to be careful that we should avoid trauma and getting injured. Those who are engaged in activities in prolonged sitting posture have to stand up for 3 minutes for in every 30 minutes. Next is about quitting bad habits. The first and foremost thing is about smoking. So if we continue smoking, even if we take regular medication, there is chance for recurrent stroke. So, but for a person who smoke for long time regularly, it may be difficult for him to quit the smoking at once. So we can seek the help of a doctor for quitting smoking. Now there are various drugs available for helping quitting smoking. For example, if we may say drugs like bupropion, nicotinamide, varenicline, these all may help the person to quit smoking. So in this regard, one more point is about passive smoking. Even if the person avoids smoking, if somebody else in the home or in the job place, if we get that smoking from a second person, that is also harmful for him. Next is about alcohol consumption. Most suitable thing for a stroke patient is to avoid alcohol completely. But if due to some various reasons one person cannot avoid alcohol completely, there are some recommendations put forward. That is, for a male person, the alcohol consumption should not be more than 2 drinks per day, and for a female person, it should not be more than 1 drink per day. And how much that one drink contains depends upon the type of alcohol we are consuming. Generally, if we say for types like rum, whiskey, and brandy, one drink means nearly 30 ml. And we have to completely avoid drugs like cocaine, amphetamine, etc. Next, we will talk about some problems which may usually go undetected in a patient with a stroke. First is about obstructive sleep apnea syndrome. That means some breathing problem that can happen in a patient with stroke when he is asleep. So there may be noisy breathing, and sometimes even without any noise that can happen. In such patients, there may be, when he awaken in the morning, he may feel lack of freshness or severe headache. So if we suspect such problem, we can do one investigation known as sleep study. And if some problems are detected, we can give him a machine known as CPAP when he is asleep, and he may get relieved of the symptoms. Now we will talk about post-stroke depression. So compared to normal population, incidence of depression is very high in stroke patient. So we have seen that after acute stroke, we may need long-term physiotherapy, rehabilitation exercises, and there need a lot of initiativeness from the patient side for progress. But if the patient is having depression, these patients may lack such initiativeness, and it may hamper the progress in condition. So if patient has such symptoms, we may approach a psychiatrist, and there are now a lot of drugs like escitalopram are available to treat this condition. Stroke happens after an age of 45 to 50 years. So if it is happening before this age group, it is generally labeled as young stroke. So usually habits like smoking may be the reason for stroking young age, but rarely some genetic disorders, some disorders of clotting, blood clotting, or some heart related diseases. These all can lead to stroking young age. So if you are not finding it and treating it, there may be a chance of recurrent stroke and patient may go into a debilitated state. So it is always better if stroke happens in this age group, they have to undergo detailed evaluation. Next, we will talk about some points which may be useful for those who take care of patients with severe stroke who are bedridden with severe disabilities. So, some complications can happen to such patients with severe stroke. For example, if we may say bed sores, pneumonia, uh, deep vein thrombosis, that is clotting happening in the blood vessels in lower limb. So we may see one by one what all we can do to prevent these complications. First of all is bed sore, that is pressure sore. So we have to change the position of patient every at least every 2 hourly. We have to make him right lateral. Then after 2 hours, we have to make him left lateral. Keeping the patient in same position for a long time can lead on to bed sore. And we have to avoid foldings in the clothes used for beddings. So these foldings can act as a source of pressure, and if we get some air mattress, that also can reduce the chance for bed sore. Next is about pneumonia. So it is always better to keep the patient in lateral position, either right lateral or left lateral, so that it will prevent the aspiration and chance for pneumonia. And if there is some prolonged cough or fever, he has to undergo checkups for finding out pneumonia. So third is regarding tubings. There may be tubings for feeding, that is Riles tube, and also for urinary bladder drainage. So uh, before discharge, when the patient is in hospital, then itself the caretaker has to learn how to take care of these tubings, when to give feeding, how to give feeding, and what all we can give, that also we have to learn. And regarding urinary bladder drainage also, if there is some pus coming through the drainage, we have to evaluate for urinary infection or otherwise fever or abdominal pain. If the patient says he has to undergo checkups to checkups for urinary tract infection. And every usually every 3 to 4 weeks we need to change these tubings. And one more point is about deep vein thrombosis. Since the patient is not able to move his limb of his own, there may be chance for clotting inside the blood vessels in the lower limb. So we have to mobilize the lower limb every hourly. And if there is any evidence of edema or tenderness, he has to undergo checkups to find out the evidence of thrombosis. Next is few points about palliative care services for house visit. So especially for patients with severe stroke who are in a bedridden state, it may be difficult for patients to reach the hospital for frequent evaluation. In this, we can seek the help of a palliative care service. So they can monitor the patient regarding the comorbidities, progress of the condition, and frequent changing of the tubings, delivering the drugs, and providing the equipments for disabilities or air mattresses, and above all training the caretaker for patient care. So if we summarize regarding stroke treatment, that acute treatment is the most important one, that is dissolving the clot through injection or removing the clot mechanically. So if we are not getting the treatment and if the stroke is getting established completely, even though even if we recover from the disabilities, that damage happening to the brain may not improve. So even then, no need to worry. With continuous care and treatment, there will be improvement in the condition. So this video has been prepared according to American Heart Association or Stroke Association guidelines. If you have any doubt, you can comment it in the comment box. We will see in next video. Bye.